Really an honor and a pleasure to be with you all this evening. I am just in awe of this organization that I have been involved with since the onset of the organization. So as Jim said, I'm a pediatric rheumatologist and immunologist by training. And for the past 30 years, I've focused my clinical efforts and my research on juvenile myositis. It's really been a journey that I've taken, and it's been wonderful to see the advancements and the acceleration of the work that's happened in the past, 15 years since really CureJam has been present. My early career, I really started looking at the genetics of the disease, understanding why certain subsets of children got the disease. That morphed into really looking at what was going on in the tissues and in the bloodstream of children, looking at the cells that are involved and how they're interacting, and really allowed us to understand much more about the disease. And then in recent years, I've taken a little bit different twist to my work and really wanted to study understanding of the subsets of disease and who responds to medications and how do we tell that ahead of time, and how do we almost profile a child so that we're not getting medications they don't need, and how do we really work to understand more about those subsets of the disease. And so this is fit, I think, really well into the mission of CureJam and a lot of what CureJam has been standing for. And tonight I just want to share you a little bit of my view, my historical view of juvenile myositis research from CureJam's founding in 2003, like I said. I also at the end want to share a little bit what I think are some really amazing opportunities on the horizon for us to understand more and to help treat children. So when CureJam was founded in 2003, there was really little research going on, and really little was known around juvenile myositis in general. We did not have clinical protocols, so everybody sort of treated children differently depending upon how they were trained. And so we now have clinical protocols, which is a huge advancement. There was only a small amount of, just a fraction of the research that's going on today. And in large part, a lot of these are milestones that CureJam helped to create. So one of the first milestones CureJam created was the book, Myositis in You. I'm sure you all know, but what a wonderful thing for people to have, to be able to reach out and get information that maybe they weren't able to find in other places and other areas. Also, the development of the Medical Advisory Board, as Jim said, it is a collaborative group of individuals from around the world that work together. We don't get me wrong, we're all wanting to do the best that we can, but we work really well together, and we really want to try and help support CureJam to be able to be the kind of organization that it is today, and even better. And we work together to guide the research priorities, to really understand where the investment should be, and to also help inform all the families of the latest information that's out there, and really also to have them understand where is the research going, and maybe what areas of research should we be focusing on advancing. CureJam has really been key in supporting all of these and many of these efforts. And they've funded over 175 research studies that really have resulted in our improved understanding of the disease, and subsequently our improved treatment of the condition and disease, and really moved us closer to the cure. Also, the support has created and provided financial support for 4 major centers across the country that are CureJam Centers of Excellence to advance juvenile myositis research and really deliver world-class care. One of those centers is at George Washington in Washington, D.C., another at Lurie Children's, which is in Chicago, and Seattle Children's, which is in Seattle, and then Duke is the other one that's here in North Carolina. So, if I think about really the advancements on the horizon, I first want to start and say, and I'll get to that in a minute, but I want to start and say that we have come such a long way in treatment of myositis. When I first started, I hate to say it, 30-some years ago in the area, we had very little. And actually, a few years before I started, we only had steroids. And so it wasn't until right when I about started my training that we started using methotrexate. And now we look at where we've come. We look at where we've been able to advance not only the use of different medications, but also the clinical trials to study, are they really being effective in the way we think they are? And so my participation in the rituximab and myositis trial, which was really the largest trial to date in myositis and in juvenile myositis. I was the co-chief investigator with Chet Otis from Pittsburgh. I ran the juvenile myositis portion, and also I ran all the research that came out of the trial. And we were able to show in that trial that children who had resistant disease, that rituximab actually helped the majority of these children, which was really wonderful to see that we were able to show that, and show sort of also subsets of children, subsets of adults that get rituximab. Some respond better and some don't respond as well. And that's really important to know. It was really important for us to be able to start studying that and understanding that better. And I think this is one of the key areas when I think about what's on the horizon. I think about clinical trials. I mean, you probably recently have heard about baricitinib, which is one of the JAK inhibitors, or the Janus kinase inhibitors. We call it JAK, it's easier to say, which is really showing a lot of promise in clinical trials. And there's other trials that are being planned to date to study it. When I think about, I think the key areas on the horizon, I think one is clinical trials. I think it is key for us to keep looking for better treatments, more effective treatments. And I think it's really important for us to understand when we do this, who really needs a certain medication and who's going to respond to it, and not just use it on anybody. And so I think that's a real key part of the trial. Another one of the areas that I think are on the horizon, and this is something that we found, I don't know, 10, 15 years ago, that there is a certain pathway that's quite active, and that's what we call the interferon pathway in juvenile myositis, somewhat different than adult myositis. And our ability to identify that pathway and study, and many of the experts that are on the advisory board are studying this area. So it's a certain kind of inflammation. You get different kinds of inflammation. Different things can be elevated in certain diseases. And in juvenile myositis, this is one of them. This has allowed us to further refine our intervention for patients. So the whole JAK kinase, that whole therapy came from our understanding of these pathways. And I think this is still key. The technology is here now for us to understand more and more about these different pathways, particularly this, like I say, this interferon pathway, and to understand the subsets of who really responds in certain ways. And it's going to help feed what we need to be doing in our clinical trials. The third thing I think is really important is our understanding of autoantibodies. I know many of you have heard about it in the past, but looking at myositis antibodies, our understanding of it just keeps exploding and growing. Again, when I trained, really, there was really nothing there to understand. Now we understand that these antibodies really do help us understand the subsets of disease. They also, and there's a lot of research that needs to happen to show, is it just a result? So this antibody is made because of the result of the condition, or is it actually causing a problem? And that's something that really needs to be explored further, and I think it's really key and important. So just to kind of summarize my side of it, I think that we have made huge advances in juvenile myositis, our understanding of the treatments, understanding of the biology that's going on, and advancing the therapeutics, so the drugs. However, we have a long way to go, and you all know that. You live that, you know it. We still don't have all the answers by any means. And so it's so important in my mind that we continue and pursue this, because we have really moved a mountain so far, but now we've even got a higher peak to move to continue and understand. So I thank you for letting me join you